for interact with Mr. Shireesh Sahai, who is CEO from Wolters Kluwer. So now the question is, how does CDS align with India's advanced digital capabilities, and what is its potential in improving patient outcomes in rural India?
So, clinical decision support is a digital solution which helps the clinicians to impart better care at the point of care for the patient. Why is it relevant? The reason it is relevant because the research has proven that every day when a doctor is treating a patient, he or she faces 11 clinical questions. Unfortunately, 60% of these clinical questions go unanswered. And why they go unanswered? Because he or she will not search for them in a journal. He will not have time to do that. In case he or she is able to get those answers, 5 to 7 patient decisions will change, and that can impact the lives of those patients. Now, when you look at from that context, it's very important that we have a tool like that which can answer. And UpToDate Anywhere is one of the clinical decision support tools which can do just that. It can answer any clinical questions related to 25 specialties within 90 seconds. An answer which is validated by 6,000 plus experts sitting around the world. An answer which is 3-tier peer reviewed. And last but not the least, and very relevant from the rural setting, the answer you can get even without having an internet. So on your smartphone without internet. So that is why clinical evidence-based tool is so relevant for our country, especially in the rural settings. So in US, pretty much 70% of all doctors are using it.
Okay.
In India, over the last, I would say 3 years, if you look at the top 10 medical colleges in India, 8 of them have started using them. More than 50,000 doctors in India have already started using it. And more than 100 plus hospitals are already using. So it's starting, but it's just the beginning. As we go to the rural India, I think the scale can be much larger.
Okay, so how does CDS support Prime Minister's Ayushman Bharat program?
I think it's one of the most ambitious programs, not only for our country, but for the entire world. Why? Because it covers more than 100 million families, more than 500 million people, with an insurance cover of rupees 5 lakhs.
Could you tell me about what value does the CDS driven practice at hospitals bring to the Prime Minister vision of our digitally stronger healthcare system that serves the nation better?
Yeah. So I think if you look at, if you combine the effect of using a clinical evidence-based system with an EMR system in a hospital, I would say the benefits are both for the hospital and for the patient. The biggest advantage for the hospital is that having a tool like this integrated with the EMR systems of the hospital reduces the length of stay of the patient, which is one of the critical parameter hospitals track. The study that I quoted for Harvard University, not only did it save lives, 11,500, but also reduced 300,000 days spent in the hospital in 1 year. Okay. So that is a big advantage for the hospital. But when you look at the patient, I think the biggest advantage is if the diagnostic quality or the errors in the diagnostics is reduced. I would like to highlight one more case study which was published in International Journal of Medical Informatics this year, which said that the clinicians who were using a clinical evidence-based tool like UpToDate their diagnostic error was 2% compared to 24% diagnostic error by clinicians who did not use a tool like that. So for patient, the biggest benefit is the diagnostic error. The error in treatment goes down.
So how does combining clinically decision support system like with the EHR, electronic health records, help improve patients' outcomes?
If you are having a clinical decision support, which is part of the workflow of the doctor, so when he or she is treating a patient, it comes automatically as a part of the workflow that, hey, have you taken care of this part of it? I think then definitely it has an impact on improving the patient outcome. And the studies that I quoted, most of the cases have been where the decision support is integrated with the EMR system.
Okay.
So today, in fact, we are launching an integrated solution with up-to-date, which is a clinical evidence base, with an EHR system. So till now, what I said, 100 hospitals, more than 50,000 doctors. It's not integrated, but that's why I think today is a very exciting day where we are launching. Yeah.
That is good. So is there any research that shows the efficacy of in corrupting like CDS with the daily workflow hospitals?
Yeah. So we looked at a study of around 1,200 clinicians and found that 91% of them indicated that a clinical evidence-based system integrated with EHR can improve patient outcome. So yes, there have been a study that we have conducted and we have found that. But what is even more was satisfying was that 40% of these people that we surveyed said that just having a clinical decision support helped them use EHR more. So it encouraged them to go towards EHR because they knew that, hey, it also has a clinical decision support. So I think there have been cases to prove. So that's why I'm saying I'm really excited because this is the first time we are launching that in India.
Okay.
And I really see that it will improve even the usage of the EHR and the benefit from the EHR.
So does a hospital information system like integrated with the CDS help in optimizing overall healthcare expenditures?
Like I said, both at the hospital level and the patient level, it helps to reduce length of stay, which is a reduction of expenditure for the hospital, and it improves the patient outcomes. That's a benefit for the patient, and it reduces their expenditure.
Okay, thank you so much.
Thank you.
Thank you for being here.